Lesson 2 covers interpersonal communication and imaging. A technically perfect X-ray is worthless if you can't get the patient to cooperate, and the ARRT tests communication skills heavily. We're covering verbal and nonverbal communication, language barriers, cultural considerations, special populations, and how to explain a procedure properly. 5 minutes. Let's go. 3 verbal rules that apply to every patient, every exam. Plain language. Use words your patient understands. Never say full inspiration when take a deep breath works. Never say lateral decubitus when lie on your side works. Your patient is not a radiographer. Match your tone to the person in front of you. Speak slower and clearer for elderly patients. Softer and simpler for children. Calm and steady for anxious patients. And 2 identifiers before every single exposure, without exception. Full name and date of birth. Confirm them both. Match them to the order, then proceed. Wrong patient errors are preventable. 2 identifiers are the safeguard. Studies consistently show that more than half of human communication is nonverbal. Your body communicates before you speak a single word. Make eye contact with the patient, not the control panel, not the monitor. Keep your facial expression calm and confident. A worried look on your face raises the patient's anxiety immediately. Announce touch before contact. I am going to move your arm now. Always. Every time. Respect proxemics. When you enter a patient's personal space to position them, explain why. I need to get close to position your chin. Is that okay? And read the patient. Crossed arms, a clenched jaw, avoiding eye contact. These signals tell you more than words. Language barriers require a qualified medical interpreter. Every time. Federal law prohibits using a minor child to translate. Using a family member is strongly discouraged. They may omit critical information to protect the patient. Know your hospital's language line. Know how to access video remote interpreting before you need it. Cultural considerations to always respect. Some patients prefer a same-gender radiographer for religious or personal reasons. Ask before assuming. In some cultures, direct eye contact is disrespectful. In others, cross-gender touch requires a chaperone. When in doubt, ask. Is there anything about your background or beliefs I should know before we begin? That one question covers most situations. 4 populations with specific communication approaches. Pediatric patients, speak to the child directly, not just the parent. Use non-threatening language. Teach back works well. Can you show me how you'll hold your breath? Allow a comfort item. Let the parent stay when clinically appropriate. Geriatric patients, allow extra time. Face them directly, speak clearly, check for hearing aids. Avoid elder speak, no baby talk. Confirm understanding gently before proceeding. Cognitively impaired patients, short, direct sentences, 1 instruction at a time. Demonstrate the action, engage the caregiver. And anxious or phobic patients, acknowledge the fear before starting. A lot of people feel nervous about this. Let me walk you through exactly what will happen. Give control back. You can ask me to stop at any time. 6 steps. Every exam, every patient. No shortcuts. Introduce yourself by name and role. Confirm 2 identifiers. Explain the exam in plain language. What it is, how long, what they'll see and hear and feel. Explain their role, breathing, position, what to hold, when to stay still. Invite questions, then actually listen. And confirm understanding with teach back. Can you repeat those instructions back to me in your own words? Nodding and saying okay is not confirmation. 3 communication questions. Think before the answer drops. The answer is C. Contact the hospital's qualified medical interpreter service. Federal law and the standard of care both require a qualified medical interpreter for medical communication. Never a family member, never a minor child. Using a minor to translate consent is both a federal violation and a standard of care failure. The answer is B. Acknowledge possible anxiety and address their concerns. Crossed arms, avoided eye contact, and one-word answers while saying, "I'm fine," is a textbook example of nonverbal communication contradicting verbal communication. A skilled radiographer responds to the nonverbal signals. The answer is C. The patient repeats the instructions in their own words. This is the teachback method, the gold standard for confirming comprehension. Nodding, signing, and staying quiet do not confirm understanding. Restatement in their own words does. Communication is the skill that makes every other radiography skill possible. Practice these habits on every patient, and they become automatic.